I'm Matt Willis, Public Health Officer, with today's COVID-19 update. Yesterday, the governor announced that Marin County has maintained its status in the red tier in the state's COVID-19 blueprint. This places Marin residents among the less than 1% of the California population that are not in the purple or most restrictive tier. I'd like to talk about what that means for us and about us as a community. The first is to remember that a couple of weeks ago we were in orange, a less restrictive tier, and our case counts are rising. So it's faint praise to say we're less bad off than everyone else. The worst thing we could do is take false reassurance and let down our guard. Still, only one county of 58 has lower case rates, and it's a small rural county. So this is a good time to try to name those things we're doing right, so we can lean into those strengths when we need them in the challenging months ahead. Here are some contributors to our relative success. Every year, the Robert Wood Johnson Foundation ranks counties according to overall health. Each county is assigned points based on things like life expectancy, rates of regular exercise, fast food consumption, smoking rates, and other factors. 9 of the past 10 years, Marin has been ranked number 1 in the state. Most of these health factors come down to choice and opportunities to make healthy choices. Marin is also among the most affluent communities, and we know there's a strong association between health and wealth. This relates to our COVID-19 response, because compared to other communities, more of us have the privilege to control our exposure risk. That's not to say that it's easy or automatic. It's hard work to control COVID-19. But I'd like to think that as a culture, we value health and well-being enough to do that hard work and make the sacrifices that protect us all. As much as we see exceptions that stand out, it's true that when you walk down the street in most part of Marin, the majority of people are following the regulations out of respect for themselves and for one another. And if that's true, that's what's normal in our everyday behavior is protecting us, that's a critical asset. And this might explain why we're able to maintain more open policies than most other counties. By and large, our businesses have been as open as the state would allow. And more than 73% of our schools have reopened to some form of classroom education in Marin County. Another success factor is our focus on the hardest hit low-income communities. While deep-seated inequities that fuel community outbreaks persist, we have found better ways to mitigate them. We've increased bilingual contact tracing capacity, culturally responsive messaging, income support for missed work, food support, and support for isolation, and access to testing. The Canal area of San Rafael had a positive test rate of 40% in July. By October, more than half of the Canal residents had been tested, and now the positivity in that community is just 4%. We would not have been successful without trusted community leaders in the Canal, in Marin City, Novato, West Marin, and other communities. They've done way more to engage communities than we could have done independently as a health department. The current driver of spikes in cases in Marin has shifted beyond marginalized populations, and is now flowing in mainstream. More cases are now among whites and distributed across the county, and is more related to social gatherings. This is disappointing, but it also means the virus is moving between residents that have the freedom and resources to avoid putting themselves and others at risk. What's left is the vulnerability we all share, the biological vulnerability that we all can be infected if we're in close proximity to someone outside of our household for too long. Our relative success, remembering we're being graded on a curve in a state with skyrocketing cases, says we have some ability to influence this. We have some control. Our ranking among the healthiest counties show that we value health, we can respect the science, and that many of us have freedom in our everyday lives to control our risk. With that freedom comes responsibility to do the hard work to prevent spread, knowing others are at risk, not by choice, including the healthcare worker who will have to take care of you and potentially be exposed if you take unnecessary risks. Thank you for doing your part to protect our most precious resource, which is one another.